Oh.
A special good evening, everyone. Hi, everybody, and welcome again. My name is Director Sandra, and I'm your sport lady host for the next hour. I am so thrilled for this moment. I am so happy that you take the time to join us. For the record, I just want to feel the vibe of our people we have tonight. In the chat, just shout out your first name and where in Barbados you from. Okay. This educational series is geared towards the minority, which is the deaf and hard of hearing community in Barbados. It also gives the opportunity to reconnect with all interpreters and make room for the new ones to upgrade their skills. It will give the opportunity to learn something even if you know already. So let us get in the attitude of learning and educating ourselves. It's open to all classes of people. It doesn't matter their religion, who or where, but we have respect for all persons. One of my daughter's favorite character story is Cinderella. All her youth, she was preparing for the best is yet to come. The best day came, and the better came on a missing glass show. It is said, better late than never. We have certainly, yes, the best has come, but better is in the horizon, and much more is in store. You won't want to miss another series after tonight, so I'm holding on to this. In our midst is a very special young lady. Let me tell you something about Dr. Tiffany Jordan. She is very special. She is very humble young lady and very passionate about people. She takes deep interest in patient care, and that is her specialty, primary care doctor, with special interest in HIV medicine. She graduated from University West Indies Carefield campus in 2013. Tonight, she has accepted the challenge to speak about your health to success. During the session, and you need to ask questions, you can private message me so I can relate your question to the doctor. So that is enough of me talking now. Over to the speaker. Dr. Jordan, welcome again.
Thank you. Thank you. All right. Good night, everyone. Thanks for giving me the opportunity to come and speak about health in this space. It's very nice to meet all of you. I hope that the session will be useful. It isn't laden or burdened with a lot of statistics or a lot of detail, but is a presentation about how to maintain general health. And if you have any deeper questions or you need more detail on anything, you can feel free to just ask, and I will try my best to answer your questions. So I'm going to be discussing what health is, what makes for good health, and why it's important to be healthy, and how to maintain good health. So health may be defined by some people as the absence of disease from the body, but it should be considered in its total definition, which includes not only physical health, but also emotional health and mental health. So we take everything into consideration, and this is in keeping with the World Health Organization's definition of health. So in order for us to maintain our health, there are several things we need to consider. We need to consider our nutrition. We should have good nutrition. We should get enough sleep. We should get enough exercise, regular exercise. Practice good hygiene. Practice safe sex. Get regular health checkups at our doctor at least once a year. Avoid things like cigarette smoking, heavy drinking, and using drugs such as cocaine and heroin. And also, we should take care of our mental and emotional health. So why should we consider our health so seriously, especially if we're young and nothing goes wrong with us? Like, why is it important for us to think about health in our youth, or at whatever stage of life we may be? It's important because maintaining good health early or at any stage in our lives can increase the number of years that we live. And if we look at the pictures at the bottom of the screen, would we prefer to be the person on the left or the person on the right, the people in the right, in our old age? If we lead healthy lives now, we can hope to have good quality of life in our old years, free of aches and pains and illnesses, or at least to have them in our lives as little as possible. We know that death is something that is going to happen for most of us, for all of us, sorry. But we can reduce how much we suffer in our lives if we take care of our health. So being healthy, living a healthy life will reduce our risk of chronic diseases such as high blood pressure, diabetes, heart disease, and risk of heart attacks and strokes. And it will also reduce your risk of getting things like cancer. So living a healthy lifestyle really has a lot to do with what we put in our bodies, right? Our health is very closely linked to what we eat and drink every day. And I have a picture here which shows what a healthy plate should look like. So in Barbados, when we go to buy food, we usually have almost the opposite of this, of what this plate is showing. This plate is showing that half of what we eat on our plate should consist of vegetables and fruits, right, with each meal. And just about 25% of our plate should be some form of healthy protein, like fish or chicken, etc. And a quarter, the plate should be whole grains, which would include things like rice, brown rice. But in Barbados, we tend to have the flip side of this. We eat almost half of the plate is usually something like macaroni pie or rice or pasta. We have just a little bit of salad on the side or as garnish, and we don't tend to eat a lot of fruits with each meal. And that contributes to a lot of weight gain because carbohydrates having a lot of sugars, and depending on how they're prepared, it can have a lot of fat, like in the case of macaroni pie and lasagna and all of those types of food that we like to eat, and the way that we prepare our meats as well. And a lot of that gets stored as fat, and that fat increases our risk of getting things like heart disease, diabetes, increases our risk for strokes and heart attacks in the future. So you want to get a lot of vegetables in your diet, right? With each meal, and these can include things like carrots, broccoli, whatever your favorite vegetable is. You can try to eat a lot of it and try to vary the types of vegetables that you have. In Barbados, we will have seasonal vegetables. And there's a lot of fresh vegetables that sell in the market, and it's a good idea to try to buy these fresh vegetables each week. People tend to think that eating healthy is expensive, but you can go to the markets. I have done it and get a reasonable amount of food, a reasonable amount of vegetables and fruits for something like, well, depending on how many people you have in your household to feed, you can get a lot for $40, $20. So it is possible. And you can also, while you're there, you can also buy things like fresh fish and poultry. But it's important to avoid red meats because these tend to be very high in fats and in the wrong kinds of fats. And it's been found that red meats and meats that are preserved, like luncheon meat, bacon, hot dogs, hamburgers, those types of things, they contain things in them that can cause cancer. So it's very important to avoid those types of things. Unfortunately, in Barbados and in a lot of homes, probably in other Caribbean countries as well, those types of canned and preserved meats tend to be the things that we eat a lot because they're readily available in the supermarket. Some of them are relatively cheaper than perhaps, you know, going to buy fresh meat. And they're convenient because you don't have to cook them for very long or prepare them for very long. But it is definitely worth preparing your food, preparing fresh meats instead of using these types of preserved meats, because in the long run they might result in things like cancer. They tend to have a lot of salt, which I'm going to talk about later. And so it's important to try to keep these things to a minimum, use them as little as possible or not at all if possible, and try to use fresh fish and poultry. For people who are vegetarian, they can get their proteins through things like beans, peas, nuts, and other types of vegetables will also contain varying degrees of protein. So they'll still be able to get those as well. With regards to carbohydrates, also try to avoid things that contain a lot of, we call them a lot of refined carbohydrates. Those would be your white pastas, white bread, biscuits, those types of things. They tend to result in a lot of constipation. They can push the blood sugar up very quickly, and they're very bad for people who have diabetes. So you want to stick to healthy carbohydrates and healthy grains. Try to favor brown rice as opposed to white rice, and try to limit the amount of sugar that you have on your plate also. And sugar tends to come in our meals through what we drink. I'm also going to discuss this a bit later. So here you also see in the upper right corner, healthy oils. Again, in the Caribbean, we use a lot of butter. We use a lot of oil, and in some places, some kitchens, people still use lard. And these can contain fats that can again be stored in our body, can actually get into our arteries and cause issues with the way our heart functions and increase our risk for certain types of diseases. And I'm going to discuss this a bit further. So just keep in mind, this is what your plate should look like. You may not be, if your plate looks like the average Bajan plate right now, it's not too late. You can slowly start to convert into having more vegetables, more whole grains and healthy protein and fruits on your plate. All right, does anyone have any questions? No? Okay. All right, so many diseases and conditions are actually linked to the foods that we eat. We have a high prevalence, or so many people in Barbados have either diabetes or high blood pressure, and that is not by accident. We have these things in our country in great numbers because of how we eat as a people. And so we need to modify or change the way that we eat. This is going to help to reduce the amount of diabetes and high blood pressure and strokes and heart attacks that we see. And also there are certain types of cancers that are linked to the foods that we eat. For example, colon cancer is one of them. Cancer of the stomach. They're all closely related to the types of foods that we eat and other lifestyle practices, which I'll discuss later. All right, so fatty foods. Why would we want to avoid eating fatty foods? I'll go into this in a little bit more detail. So these are foods that we see at the fast food restaurants. So you can see here pizza, chips, burgers, and chicken frying. And a lot of these foods are prepared in high fat environments with a lot of oil and butter. And what they do is that the fat is stored, and some of it gets into the blood, and it actually attaches onto the sides of the arteries, and it begins to form what we call plaque, which is like the same way that calcium forms in pipelines. These fat molecules will attach to the sides of our blood vessels in the form of something called cholesterol, and this can then reduce the blood flow to important organs like the brain and the heart, and increases the risk of getting strokes and heart attacks. Fat also increases your risk of getting diabetes, and the way that it does that is by reducing our body's response to an important hormone known as insulin. I see a message in the chat box. Oh, okay. Right. So when we have a lot of fat stored in our bodies, it can affect the way that we respond to insulin. We need insulin to help us to store sugar, to move the sugar that we eat, which gets into our blood, out of the blood and into the body storage organs, so that it can be stored for energy later. Now, when we have, as the amount of fat in our bodies increases, the responsiveness to the insulin decreases. Just let me know if I need to say my words differently, or just for the translator. Just let me know. Okay, so you can also just shoot me a message. All right, so essentially, having a lot of fat will increase your risk for getting diabetes, and losing weight. If you lose up to 5% of your body fat, you can actually decrease your risk of getting diabetes significantly. So keeping your body weight at a certain level decreases your risk for getting these types of conditions. However, if you eat a lot of fatty foods, that increases your risk of getting these conditions. All right, moving on to the next slide. Right, so this is just a picture to show you how the fatty foods can lead to a buildup of fat, or what we would call plaque in the arteries. So this is an artery which is supposed to transport blood through the body, and this is how it's supposed to look, right? The blood flows through this area here. But when we have very high fat diets, the arteries can get clogged, right? And it narrows the pathway for the blood. This area where the blood is supposed to come through, it's supposed to be like this, relatively clear and white, but it narrows when we develop high cholesterol levels from eating a lot of fatty food. Over time, these blood vessels can become so clogged that blood does not get by easily. And if this happens in the blood vessels to the heart the blood might stop getting to the heart. And that's basically what a heart attack is. The person can develop a heart attack. And if these blood vessels are in the brain, right, then the blood may not be able to get to the brain, to the cells in the brain, and you can get a stroke. So eating fatty foods can lead to these problems. The other thing that we tend to eat a lot of in Barbados are sugary foods. Or should I say we tend to drink a lot of sugary drinks in Barbados. And I guess all over the Western world, in the US, in Europe, there's a huge problem with these types of things because most people drink the things that you can see in the picture below, things like Coke and Sprite, etc. These are all very common drinks, and even our pine hill dairy juices contain a lot of sugar. And these things, sugary snacks and drinks and foods, again can lead to building up a lot of body fat and can cause increase your risk of getting diabetes. We're only supposed to take about 24 to 36 grams of sugar in a day. This is like 8 to 9 teaspoons of sugar. But a lot of these drinks contain quite a lot. So for example, right here in men are supposed to take about 9 teaspoons of sugar and no more than that. Women, 6 teaspoons and no more than that. But a single can of Coke can have in as much as 10 teaspoons of sugar. And most people will drink more than one of these sugary beverages in a day, right? You might have one with each meal. You might have this with a meal, and then you may have pine hill dairy juice later. You might go for refills of the pine hill dairy juice, and then for at lunch, and then for dinner, you might have the same thing, or perhaps you put a lot of sugar in your tea, etc. So if we're intaking a lot of sugar during the day, every day, then this is going to lead to a lot of fat storage and to high blood sugar levels, which is eventually going to affect our ability to manage our blood sugar levels. And we could develop things like diabetes and other types of chronic diseases. All right, so another vice in our country is salt. Now, we're supposed to take in just about 2.3 grams of salt a day, which is like 1 teaspoon of salt. And salt has been shown to cause diseases like high blood pressure. It can cause the arteries, salt along with fat can lead to stiffening of our arteries, which can cause our blood pressure levels to go up. I always say that the blood vessels are like pipes which carry water, and over time when pipes get a lot of calcium buildup or they get really hard, the pump has to push harder to get water through them. So this happens with our heart. The higher our blood pressure is, the harder our heart has to pump to get blood out. So if the heart has to pump hard over a long period of time for several years, eventually it's going to give out. So this can lead to heart failure. It can lead to, again, things like heart attacks and strokes. So having a diet which is high in salt can cause us a lot of problems and reduce the number of years which we can live. High blood pressure can also damage the kidneys and can also lead to problems with your eyes, with vision. So we tend to add a lot of salt to our foods in Caribbean cooking. All right, so we have a question: how to get rid of slough wounds from growing in the body? All right, I'm going to. Is it okay if I come back to this question at the end, or would you like me to answer it now? Come back at the end.
Yes, you can continue and you answer all the questions at the end.
Okay. All right. So, right. So salt is very tricky. It's found in a lot of things that we wouldn't think contain salt. A lot of canned foods, such as things like tomato sauces, ketchup. We have somebody also messaging in the chat. All right, so people are asking some dietary questions about purging and about sea moss. All right. All right, I'm gonna just quickly finish up with this slide, and then I'm gonna get to the dietary questions. All right, so what I would like people to do is read the back of the cans where the food labels are when you are buying canned goods or when you're buying any type of food, really. You can look at the food or the nutrition label, and that will tell you how much salt and how much sugar or carbohydrates is in the food, right? It will also tell you how much fat is in your food. And I want you to remember the numbers that I am showing you. You can write them off. And I want you to use this to decide if you will buy that food product or not. You can look at the back of a Coke, for example. Sometimes Coke tends to contain quite a lot of salt, more salt than you would think, and quite a lot of sugar. So read your food labels to help decide whether or not you're going to make a particular purchase, especially those of snacks. A lot of snacks contain salt, chips and those types of things that we like to buy, or even the nuts that we like to buy, salted nuts and pistachios, those types of things are high in salt. And in Barbados, we tend to eat a lot of nuts. So it's important to just be mindful of how much salt and sugar you're taking in. All right, so in the chat, someone had asked about sea moss. So when this person is talking about sea moss, do they mean sea moss in its like preserved form? I think it comes in a preserved form where you can eat it like chips or something, or it comes in a drink. If it's a sea moss beverage, I advise you to look at the back of the bottle, at the nutrition label, and see how much sugar is in that. That will tell you whether it's if it's something that's good to drink. I'm honestly not sure what the sugar levels in sea moss beverages are, but if you notice it has quite a lot of sugar, then it's probably something you should avoid drinking. I'm not sure about the fiber content of sea moss, but if it does have a lot of fiber in it, it would be something that is relatively healthy. Fiber helps to reduce cholesterol levels, so eating a high fiber diet is extremely important. These would include things like whole grains, so you can choose to use like whole grain bread, using things like oats, oat flakes, bran, all of these types of things that, and also certain types of of carbohydrates like cassava and even popcorn. All of these things have a lot of fiber in it, and fiber is very good for reducing cholesterol, and it's very good in preventing things like colon cancer, other types of colon disease. Someone else is asking about what they should take to purge the body to cleanse the blood. So I don't usually recommend purges because the body has its own way of cleaning the blood. Our blood is cleansed by our kidneys, our liver, and our spleen. And I don't think any of those purging products you might see on the health shop shelves will do as good a job as our kidneys and our liver and the organs that are designed to cleanse our blood. What I would recommend is eating a diet that has a lot of vegetables, as I mentioned before, and vitamins that have a lot and that have a lot of nutrients. This is going to help to keep your body healthy, and making sure you get vitamins like iron and vitamin B12. Those things are going to help you to produce the blood that you need in your body to keep your hemoglobin levels normal. But I don't particularly recommend any particular purging product. Yes, drinking water before going to sleep is fine, because we tend to sleep for usually 8 hours or so, and so we're without water all of that time. And the only time I wouldn't recommend drinking water before going to bed is if a person has an issue with bedwetting, or if they get acid reflux. Then you should probably drink water about an hour or two before bed. With regards to the person who is asking about wounds, I think I would have to ask you more questions about that, so I'll definitely take that one after the lecture. All right, so now I'm going to move on to talking about sleep. So how many hours of sleep do you think we should get at night? I'm going to put that question out there to the audience. Or how many hours of sleep do you get at night? Right, 8 hours is very is usually enough for adults, right? And sleep is important because it's during sleep that all of our cells regenerate. Our brain. Okay, so right. Well, we tend to sleep 12 hours in our younger years. There's a graph that I'm going to show you, but generally adults need around 8 to 9 hours of sleep, or 7 to 9 hours, I should say. It helps with brain function. It helps to boost energy and with mood as well. It allows the body to repair itself, as I mentioned before. And it helps to reduce your risk of getting certain types of chronic diseases like diabetes and high blood pressure, and reduces risk of things like depression and anxiety. In our time, a lot of people tend to practice very poor sleep hygiene. Sleep hygiene is basically the habits that you develop around the time that you're going to bed. it's important to set a period of time to kind of wind down at the end of the day. Just before you go to bed, this can be for about half an hour or so, to ensure that you avoid using things that emit blue light, such as cell phones, the television, computer screens, etc. It is important to stop using those things about an hour before you go to bed. And this allows for the sleep hormones to take effect, melatonin and other sleep hormones. And also it's important to not eat or drink alcohol too close to bedtime, because this can affect sleep. And to try and sleep in a room where it is dark and cool, and where you can fully relax before going to bed. So someone is asking a good question about having a sleep disorder. And someone else is asking a very interesting question about whether some chronic diseases can create sleep disorders. So I'll answer the last question first. So sleep disorders can be caused by many different types of things. Sometimes they can be caused by what we eat. So if a person is drinking a lot of caffeine, or using any type of caffeinated products frequently and near to bedtime, it can create an issue with sleep. Also, certain mental health conditions such as depression, anxiety, attention deficit disorder, and other psychiatric illnesses can cause issues with sleep. So if a person is having trouble with sleep, it's important that you go and visit your doctor. They will take a history and ask you specific questions to try to find out what the cause of the sleep disorder might be. First of all, they will try to define what kind of sleep disorder you have, because there are many different kinds, and they may be able to pinpoint things that you're doing around the time of bedtime that might be affecting your ability to sleep. Because sometimes not sleeping can be caused by very simple things that we might not be noticing, and sometimes it can be something serious. So it's important to go to your doctor. All right, and to answer SCWB Belgrave, there are certain types of disorders that can cause, of chronic diseases that can cause sleep disorders. I would say, well, thyroid disease isn't necessarily considered a chronic disease, but definitely thyroid disease comes to mind. In certain types of thyroid disease, you can sleep for very long periods, longer than you should, and in others, you may have trouble sleeping altogether. So that is one type of disease that could lead to issues with sleep. As I mentioned before, psychiatric conditions. I don't know what other chronic diseases you're thinking of. Perhaps you could mention one if there's one in particular that you're thinking of. And chronic diseases tend to be treated with various types of medications, and drugs themselves sometimes can affect your ability to sleep. So if you've been diagnosed with a chronic disease and you've been started on medication, and you notice that since you're having trouble sleeping, you're having insomnia, you should go to your doctor to find out if the particular drug you started has insomnia as one of its side effects. So that's also something to take into consideration. Okay. All right, so this is just a chart. This is just a chart showing the recommended sleep times based on age. So as I mentioned, for adults, the recommended number of hours for sleep is 7 to 9 hours. We sleep for much longer periods when we are younger. From the time we're born, we can sleep for up to sometimes 20 hours a day. Newborns sleep very long, and basically they only wake up to feed. And the period of time tends to shorten as we get older. And this is because when we're young, we're still in the growth period of life, and sleep is very important to growth and development. Right. Um, okay, so the next topic I'm going to move on to is exercise. Right, I think most persons would agree that that they already know that exercise is important for good health. And this is because it helps to keep our cholesterol levels down. It even helps to regulate our blood sugar. It helps to get our heart rate up, and helps with our heart function. It helps with blood flow to all of the vital organs. Um, it helps to release stress and keep stress hormones down. It also is very good for brain function. It's good for our mental health. It helps reduce the risk of depression and anxiety. And it increases levels of happiness. There's lots of hormones that are important for happiness, which are released when we exercise. And overall, regular exercise actually increases life expectancy. So it's very important for good health and long life. Experts recommend that we get at least 30 minutes of exercise 5 days a week, for at least 5 days a week or more. This can be any form of exercise: walking, running, swimming, biking, whatever form of exercise you like. It doesn't have to involve going to the gym 5 days a week for an hour. A simple 30-minute brisk walk where you allow yourself to break out in a sweat and your heart rate goes up, um, 5 days a week can give you the same results in terms of your heart and your heart health, your cholesterol levels, as running marathons, believe it or not. So exercise doesn't have to be complicated. I know that for people who work, it can be difficult to find the time, but it's definitely worth the effort to carve out the time in your schedule each week to get in a decent amount of exercise. All right, so I'm just going to touch briefly on practicing good hygiene. This is also important for health. It is something that is very obvious and it can be taken for granted, but practicing good hygiene helps to reduce the risk of getting infectious diseases. It's important to ensure that we take care of our oral health, which involves brushing and flossing our teeth, and using a good mouthwash as well. That helps to keep the bacterial load in our mouth down and reduces your risk of getting dental or periodontal disease. Taking showers daily, twice a day, keeping our nails and hair clean, regular hand washing is especially important, especially after using the bathroom, before preparing meals, and if we have to, go and touch a lot of doorknobs, and say we're in a public place and you have to go to the bathroom and you have to touch doorknobs, etc. It's important to ensure that you wash your hands as soon as you can, because surfaces can contain quite a lot of germs. And I wouldn't necessarily have to remind anybody in this day and age about the importance of wearing face masks, since we're currently still involved in the COVID pandemic. Wearing a face mask and regular hand washing are especially important. Sexual health is a part of health. I think many people forget this when discussing general health. But sexually transmitted infections are responsible for quite a significant burden of disease and are common reasons why people visit the doctor each year, especially people within the 15 to 24 age group. So I'd like to just touch on this as well. It's important to get tested at least once a year if you're sexually active. You should get tested for HIV, for chlamydia and gonorrhea, for hepatitis B and C, and syphilis. There's other types of viruses that you might consider being tested for, and you should discuss these with your doctor. Here in Barbados, the prevalence of HIV is still relatively low. It's around 1.6% in the general population, but it's higher, around 13% in men who have sex with men, or otherwise known as gay men. And the prevalence of chlamydia and gonorrhea chlamydia in Barbados is also quite high. It's around 13%. So getting tested for these sexually transmitted infections are very important when a person is sexually active. Not only should you yourself go to get tested, but you should also take your partner to get tested. Because if you or your partner have a sexually transmitted infection, it's possible that you may pass it on to each other. If both persons are tested and treated for any sexually transmitted infections they may have, this helps to reduce your risk of basically passing it on to the other. So I always recommend getting tested at the start of your relationship to reduce your risk of getting any STIs, and also to aid with early diagnosis of sexually transmitted infections. To help reduce your risk of getting other types of getting STIs, you can also use condoms. It's important to use these consistently, especially if you have more than one partner, or if you or your partner does not want to be tested for whatever reason, or if you feel uncertain about your partner. Okay, so in addition to being screened for sexually transmitted infections, there's other important types of screens and checkups you should get. These include checkups for hypertension. So you should ideally get your blood pressure checked at least once a year to ensure that your blood pressure is still normal. You should get your blood sugar checked to ensure that you don't have diabetes, and your cholesterol levels checked to ensure that they are not high. Your doctor can also check your weight and calculate something which is called your body mass index, which will tell you if you are a decent weight for your height, or if you are overweight, underweight, or obese. There's other types of screens that can be done for cancer, and these include screens for things like colon cancer, which is recommended around age 45. If you are age 45 or older, especially if you have a history of cancer or colon cancer in your family, you should talk to your doctor about getting screened. Is very important because screening can prevent you from developing cancer later on down the road. Mammograms are also important for women around age 40. They can start doing these screening exams, and they can also do screening at home where they palpate the breast, or they feel the breast for the presence of any lumps. And there's lots of information that you can find on sites like the CDC, which will show you how you can feel for the breast lumps at home, how you can examine the breast at home for lumps. And women should also get pap smears every 2 years once they've been sexually active, and over the age of 21 years. They can have pap smears, which are meant to check the cervix, to check for any signs of cancer. And prostate tests should be used by men over 45 years old. This can be in the form of a blood test called the PSA, or prostate specific antigen test, which checks for prostate cancer in men over 45. So all of these things can be made available through the public healthcare system in Barbados. You just need to visit your doctor and you can have a discussion about getting these types of screens done. All right. This also goes without saying. Good health can be hampered by use of drugs, which can include things like cigarettes and other drugs which are not illegal, such as alcohol. Alcohol consumption is not totally, for lack of a better word, banned by the medical community, but it's recommended that consumption be moderate. Women should have just about 1 drink a day, and men 2 drinks or less, to reduce their risk of developing alcohol-related illnesses or alcoholism. And use of illicit drugs such as cocaine and heroin, which can have negative impacts on the heart and the nervous system, should also be avoided. All right, so this is where my presentation ends. I thank you all for your attention, and I'm ready to take any questions you might have.
Thank you, Dr. Jordan.
Hi.
It's time now for questions. Or you answer all the questions?
Oh, I've answered all the questions.
Okay.
Oh no, I thought that was a statement. Sorry.
Okay, fine. Is there any more questions from the audience before we close off or wrap up?
So great presentation, Dr. Jordan. This is Belgrave King speaking. My question to you, my question to you is one thing to speak about being healthy, particularly healthy for success. But what if I think that I'm a somewhat healthy person? Do I still need to see the doctor?
Yes, that's a very good question. So healthy people need to see a doctor in order to maintain their health. So all of the screening tests that I would have shown on this slide, these are things healthy people can visit their doctor for, especially things like getting their blood pressure checked, their blood sugars checked, their cholesterol levels checked, and to get their weight monitored. Is important to still check in with your doctor, because sometimes things can pop up that we don't expect, especially as one progresses on in age. So around middle age, we tend to find that the risk of developing certain types of cancers increase. And so this is especially an important time where people need to be checking in with their doctors, and not just cancers, but also other chronic diseases like hypertension, diabetes, high cholesterol. These types of things tend to start around that age if they haven't started before. So the doctor's job is to screen and find these things early if they should occur. So even though you may be healthy, it's still important to check in with a doctor at least once a year.
Thank you.
Thank you for your question. Right. So somebody's asking about STD test. How often should you get it? So the CDC recommends getting tested at least once a year if you are a heterosexual, sexually active person who perhaps just has maybe one or two partners in that year. However, if you have many partners, or if you practice anal sex, if you practice having sex without a condom, or you engage in any high risk encounters, sexual encounters, then getting tested every 6 months is recommended. We would only recommend getting tested every 3 months for people who are very high risk for getting HIV and sexually transmitted infections, such as sex workers or other types of high risk groups.
I see grow like a tree have her hands up. Do you have a question? Okay, someone asked about what about the CMOS? Let me review the questions again. Is CMOS good for the body?
I'm not sure, to be honest, about the nutritional benefits of CMOS, but I would say it depends on what the fiber and nutrient content of it is. So if you read the label of whatever product it is, or however the CMOS is prepared, whether it's, as I said, in a dried form or whether it's coming in a beverage, you'd have to read the nutritional contents to check and see what is in it. If it's coming with a lot of salt in the way that it's prepared, or if it is coming with a lot of sugar in the form of a beverage, then it might not be worth consuming it, because having a lot of salt, a high salt content and high sugar content would reduce the nutritional benefits of the CMOS. I think it might contain certain nutrients like iron and other types of minerals, but I'm not entirely sure what the nutritional makeup is like. So I can't answer the question entirely. I would have to research it.
Okay. There's another question. How will we fight our depression if lack of sleep by itself?
Okay, so I'm not sure I understand the question. So, right, this is coming from Nikita Chandler. Right, can we clarify the question?
Nikita, she's asking how we will fight. I believe she said if we have a lack of sleep, a lot of depression, how can we fight it?
Okay, so issues with sleep are very common in depression. Sleep disturbance is a symptom of depression itself. Usually, persons living with depression, he's saying a lack of sleep does happen by itself. How do we reduce depression? Okay, so, well, I would say in looking to reduce depression, you'd have to find what the cause of the depression is. Is it linked to something that happened in your life to trigger it? Did it just come on spontaneously? Is it linked to perhaps a family history of depression? I think finding the cause of depression is important before you can say how to reduce it. But things like exercise, eating a healthy diet, having people that you can talk to, that you can rely on, and have a room to express your feelings to. Even things like meditation, those types of things can help to reduce your risk of getting depression. Also, if you're already suffering with depression, taking the medication that your doctor prescribes can also help to reduce your depression. And for persons living with depression who suffer with a lack of sleep, oftentimes their psychiatrist will prescribe medication to help with sleep. So it's very important to talk to your doctor, basically, to see if there's anything that is triggering it and how you can reduce those things, or if there needs to be any adjustments in the medication that you're taking. So all of those things need to be considered. And so if a person is looking to decrease their depression, they should really go and have a checkup by their doctor and sit down and talk these things out.
Okay, thank you so much, Dr.
No
Jordan.
problem.
It was a pleasure to have you with us to give us a reminder of what health is about so that we can recharge our health with success. At this time, I just want to we have to close off now. So at this time, I'm going to give a vote of thanking our sponsors, especially for our job, for what they have done to make this program tonight successful. First, I want to thank Caribbean Lines Lightning. There is look on the brightest side. They are specialized in stylish interior and exterior lights. 2 outlets are to serve you, Lower Estate and Wildy. And I want to thank them for their support. Also, Green Speed Photography. We are supporting our deaf businessmen and women. Scott William, think Green Speed Photography. Contact him for all your photographer needs. And he acted as our PRO, promoting this ad and giving thanks. Thank you for your support. The Deaf Heart Project is an organization which bridges the broken link between the hearing and the deaf community. It is their goal to reach out in many available ways to reach the unreachable. And I want to thank them also for their support. Dr. Jordan, this is a special thanks to you for accepting my offer without hesitation. I remember before I could finish my statement, she asked the question. She was ready a month ago to deliver. And I'm sure from her message tonight, we will put into practice or restart the practice or get with the flow of seriously putting our health first. Thank you for the message, and it's truly appreciated. And in the distant future, we will have her back. Yeah? Thank you.
Okay, thank you so much for having me on. I really appreciated it.
Interpreter, Muriel Stoute, I want to thank you for accepting the challenge. Thank you for your commitment, and yes, she delivered. She is very passionate about signing and always willing to help. Thank you.
And thank you too. Thank you so much for having me.
Muriel is the heart of this show. Almost 5 years later, Wall Street Medium is still keeping the small flame burning. And we are rising from the ashes to remain true to our commitment, and that is to deliver youth flash, educate, and promote our services, all in our language, Bajan Sign Language. So I want to thank you, thank Director Kevin for trying to for his part in helping us. He didn't get to do the welcome. He had a computer breakdown, but I still want to thank you for trying to get back on to get his part done. I also want to thank Director Dario. If you want to talk about electronic, he is the man. He controls the setting, the testing, and the preparation. As I want to already thank you. There are many more I would like to mention here. Their tips, interest, guidance, and many more. So I thank you, and you know who you are. So without you, I will have not have the earth to go again. And thank you to all of you who joined us here on Zoom. We had over 25 to 26 here on Zoom. And on our Facebook, we have between 5 to 7 on Facebook Zoom, but it's recorded on Facebook Zoom, so you can always go back and rewatch again. Okay, so I want to thank you for your participation and being with us. Thank you.
Thank you too.
On another note,
Pleasure.
coming next week is another presentation by Dr. Sunita Belgrave King on the topic, thinking inside the box. Wow, you got to be here. You cannot miss it. So start spreading the news to the deaf community. Mark your calendar. Every second and third Saturday night is targeting viewers like you. Same time, same place. Okay? The meeting is over, but however, the Zoom will remain open to allow the signer to do the interaction, but it will sign off at 9 o'clock. So thanks again for joining us and have a good night, everyone. Bye.
Bye. Thank you.